Here are some tips on how to deal with difficult or frustrated patients. And most of these I picked up from my attendings that I consider role models and other providers as well. The biggest thing I would like to emphasize is that at the end of the day, the most important thing is your patient care and what you're doing for that patient, regardless of the interaction, although those things do influence the patient care sometimes, if that makes sense. The first and most important thing, and this goes for any field, honestly, but is all about the delivery. Two people could say the exact same sentence and have it be received completely differently depending on the tone, body language, etc. In healthcare, I feel like a safe default is always just to be calm. So with that in mind, the first phrase that I like to use is help me to help you. And this is for when people seem frustrated, when they say out loud even sometimes like, oh, you don't care about me, you're not trying to help me at all. Help me to help you will at least try to get them to understand that we really are. You just sometimes need to articulate it. I want to work together on this is something I've seen used very effectively and does work for me as well. Sometimes patients feel very like it's one-sided, this care, that you're imposing these things on them. So if you iterate, I want to work together on this, that can help subdue them as well. I also want to put a plug in for, I'm sorry you're experiencing this, it must be hard. This is something every single medical school teaches, I'm pretty sure, and it's something that can come off a little bit cheesy or a little bit, insincere, but again, it's all about your delivery, and I find that sometimes just saying this is necessary. Now, number 5 is for when people are very angry or sometimes accusing you of not doing things. In those instances, I really like to say, I can only offer you in good conscience what I feel would truly help you, and then reiterate the steps that you are taking to try to figure out what's going on or what you can do to help them. I find that a lot of times patients don't feel heard, which, it's all about perspective. You can't invalidate what anybody says ever, no matter what. But sometimes this phrase can get you out of a difficult situation. And lastly, this I think is super important, and a lot of my role models do this so effectively. It's very hard to execute well, but pause and give the patient time to breathe. Sometimes just staying silent and sincerely, just being there, sincerely being with them, can give them some time to think, cool down, and then letting them initiate the conversation on their own terms can give them the sense of agency back and can really sort of cool out the room. Anyway, I hope these help.